We earn national awards.
We are ranked 18 among the top 100 integrated healthcare networks in the United States.
Thompson Reuters rated Baystate Medical Center one of the top 100 hospitals in the nation.
Baystate Medical Center has been designated as a top 50 cardiovascular hospital.
The Leapfrog Group has named Baystate Medical Center one of the top 50 hospitals in the country based on quality, safety, and expertise.
Health New England is ranked among the top 10 best health plans in the nation.
Our nursing care is recognized for its level of excellence nationwide.
Nationally award-winning care at Baystate Health. What does this mean to you?
Your surgeon performs highly specialized operations more frequently, which means greater expertise and better outcomes for those operations.
We are one of the safest hospitals in the country. Isn't that right?
Yeah! Our electronic medical records help us provide safer patient care.
We listen to our patients and improve with their feedback.
Our mothers and babies are more likely to have a natural and healthier birthing experience.
Quality and safety are central to our culture and everything we do. Our employees are committed to delivering you the best.
We have dedicated intensive care specialists in our ICU, physicians who are specially trained and always available.
We have a lower mortality rate. Our physicians are clinicians, educators, and researchers, offering strong primary care and advanced specialties from pediatrics to neurosurgery.
The right care in the right place at the right time means fewer hospital stays.
We prevent infections.
Our patients stay in the hospital for fewer days.
We have great doctors and nurses.
What does nationally award-winning care mean to you?
It means you have the very best care this nation has to offer,
right here in your own backyard.
I like to play. I like playing video games. I want to be a doctor. I think it's cool because if you could do surgery, I like to look inside people's body. They look in our ears and our mouths. Every time I get sick, my mom brings me to Baystate. I got a mad shot because of those people.
They actually calmed me down, talked to me. They told me what's going to happen.
The care is great at Baystate Children's Hospital.
Boom, boom, firepower.
This is the Adopt a Classroom Challenge for the area schools around Springfield, Baystate Medical Center, and the health centers. And we are collecting school supplies for the teachers and principals of the school to help with the children in the classroom.
I'm pleased through Leadership Council to be able to support the Adopt a Classroom program again through Baystate Medical Center and all our wonderful employees who are helping to support the teachers in our community who are educating our youth who will be our adults of the future.
My name is Jose Irizarry and I am the principal of Margaret C. L. School, and this is my 6th year taking part of this event. And we are very grateful for your generosity in supplementing the classroom material. Teachers and staff, we're very grateful again, and thank you very much for all your hard work.
I wanted to be a doctor since I was a child. My father is a cardiologist, and he would come home and had so much enthusiasm for what he was practicing, and I think that enthusiasm rubbed off on me. And then as I got older, it was really the blend of science and taking care of patients that appealed to me, so it was a perfect choice.
She demonstrated outstanding skills as a clinician, as an educator, and as a leader. And we actually asked her to stay on as our chief medical resident, where she developed a leadership curriculum for our residents.
There's just many moments of getting to know my patients at High Street better over my 3 years as a resident there. And as I became more involved in knowing them and understanding who they were and where they were from and taking care of them, it really made me love primary care, and it made me want to stay in the area and continue working there. And it wasn't just the patients, it was the faculty that that taught me. They were able to give me more autonomy. When you're being cared for in a teaching facility,
in an atmosphere of education and excitement that I think is the foundation for our patient care.
You really have multiple layers of care. So, the resident is the first line, so they're going to take care of you, but they're also being supervised by more experienced faculty members. So I think it's less likely that something will fall through the cracks because you have sort of a web of care taking care of you.
Our interactions are much more dependent on each other to provide better patient care. I don't think that collaboration is good enough anymore. I think we really need to be on the same team. I came to Baystate in 1988 to start my residency, and I have been here for almost 25 years, and it is the education, the atmosphere, the nurses, the doctors, the whole team is actually why I'm still here.
I love my job. I love being part of the primary care residency program and taking care of my patients at High Street. And I hope to be able to continue to contribute to the residency program, but also to become a better educator so that my residents learn from me the same way I learned from Dr. Hinchy. It's not just about knowing medicine, it's about understanding your patient's culture and who they are as an individual and what their needs and wants are and how they want you to act on their behalf. And you need to know all of those things before you can really treat someone adequately.